Hello everyone, I'm going to talk to you about Angelman Syndrome. This is a disease that's caused by deletion on chromosome 15, and this occurs at chromosome UBE3A. This is inherited by both males and females. With males, it's inactive and can only pass the carrier gene, whereas with females, it's active. This means that the female can pass the actual disease, Angelman syndrome, and the carrier. Some symptoms of this disease include loss of balance, tongue thrusting, uncontrollable laughter, cross-eyed, trembling arms and legs, also walking with your arms in the air. There's also delay in your motor skills, which consists of sitting and standing, walking and crawling, and also talking. So as you can tell, parents with children that struggle from Angelman syndrome have to constantly be watching over their children as if they were a newborn all the time, especially because these children, they never recover from Angelman syndrome. The only treatment helps them deal with Angelman syndrome. And with this disease, the probability of males passing this is 50% chance, because the 50% chance is that kids will be carriers. And this is because, like I said before, males are inactive for passing on this disease. And with females, it's also a 50% chance that the kids will have the actual disease, Angelman syndrome, and then also be a carrier. And the reason why their kids could have AS is because the gene is active, so they can pass AS, Angelman syndrome. Now with this disease, there's also effects that don't only consider the children, but also affect the parents. But with the children, there are certain treatments that they have to take, which is physical therapy for the joints, because they do have seizures and they're constantly, like, the trembling arms causes the joints to get more stiff, so this therapy will help the joints be a little looser and more comfortable for the children. There's also meds for the seizures that they have to take. They also take speech therapy, and this is because they only can speak a few words because of the delay in motor skills. And they also take behavior therapy, and this therapy is beneficial to the children because they can't interact very well with other children their age, so this helps them become more comfortable around and know how to act. However, they don't know exactly what they're doing because of the delay in motor skills. As I was saying before, this also affects the parents. For the parents, it's constant 24/7 to take care of these children. They're exhausted and they're mentally unstable because they're constantly having to look after these children until they pass away, which is also unstabling for the parents because they know they will lose their children. This also wears you out because of being taking care of a child 24/7 wears you out, and you're constantly having to worry about the children rather than taking time for yourself. And also it's heartbreaking because you know that no matter what you do to help the child, it can never be like other children that can go to college or do other things in life that most parents are usually looking forward to or dealing with at that time. This disease also has limitations for the kids, and however, there are also things that the children can do. The kids can speak few words like hello or goodbye, just little simple words to be able to have a conversation. They also can recognize certain people, like their parents or grandparents, people that they see every day, or people that have helped them out and showed kindness. They also can crawl or sit up. So like I was saying before, these children are basically like newborns or young kids, like up to about 3 or 4 years old because they can't do very much, even though they could be 12 or 13. Some things that the children can't do is feed themselves. They can't bathe alone. They also can't play alone with other kids their age because they don't understand how the other kids are reacting because their motor skills are up to date. They also can't stand up most of the time or walk. They have to have constant supervision and help. However, though, in conclusion, the parents, they have to stay positive with this disease and look at what the child can do rather than can't do, because if they look at what other parents are dealing with at that time with children that don't have Angelman syndrome, it'll make the parents more depressed and upset with the child, and what they may think that what they're doing is wrong, but it's actually, they need to look at what the children can do and look at the little things that the kids can achieve in one day, like smile or say hello or goodbye. This disease also is called Angelman syndrome because the children seem to be relatively happy. They're always smiling or laughing. They also tend to enjoy water, which makes them feel happier, and they just enjoy the water that they are in. And that concludes my presentation of Angelman syndrome. Thank you.